June is Men's Health Awareness Month, and we are taking a moment here at 5 to look at the kinds of heart issues that men face. Summa Health cardiologist Dr. Grace Iafur is also the new president of the board of directors for the American Heart Association in Northeast Ohio, and she joins us now. Doctor, in general, what are the top issues for the heart that men commonly face?
Lindsay, thanks for having me here. Heart disease is the #1 killer of men in the United States. When we're thinking of heart disease, we most commonly talk about ischemic heart disease or coronary artery disease, where you have blockages in the arteries that bring blood to the heart muscle. But you can also have things like high blood pressure, congestive heart failure, heart rhythm disorders, and even vascular disease, which sometimes in men presents as erectile dysfunction.
Oh, and some of the literature out there, it states that stress can lead to high blood pressure and obesity. So what can men do to prevent that as well?
Managing stress. There's data that says men at high risk of a heart attack and stroke the first maybe 15 minutes after an angry outburst. So controlling our tempers, managing stress, exercising, maintaining a healthy diet, limiting alcohol use, and then seeking out engagement with healthcare providers regarding understanding our risk of heart disease.
Now, we have really hot temperatures outside right now, and typically men are often the ones doing a lot of yard work in their yards. Maybe they're outside working. Can the heat and the labor factor of all of that, impact the heart and the health of the heart?
Oh, yes. So our body is meant to work in a very strict temperature range, and the heart has to work harder to try to keep the temperature cool in in settings of extreme temperature. So the heart has to beat faster, more blood flow has to go to the skin, to lead to evaporation and cooling. And so you have to be careful, avoid working outside when the temperatures are the highest, between 10 a.m. and 3 p.m. It's really hot. Maybe plan for yard work or exercise earlier in the day, later in the evening, or work indoors. Also, staying well hydrated obviously will help decrease your chance of dehydration.
Okay, wonderful advice. Now, you mentioned, sometimes men think that heart issues are something else. Sometimes they need to work on their diet. So how often should they get everything checked to make sure they're in good shape when it comes to maybe cholesterol, blood pressure, and then their overall heart health?
Heart disease shows up in men about 10 years earlier than in women. So definitely before your 40s, you should know what your blood pressure is. You should know what your cholesterol numbers are. Those are asymptomatic. In other words, you can have high blood pressure and high cholesterol and not even know it. So go to a primary care doctor, get screened for these things. If you have a family member who had any heart attacks or strokes, you should get checked for these risk factors 10 years before that family member was diagnosed, at least. And then avoiding other things like smoking, excessive alcohol use, and as we said earlier, managing stress decreases your risk for heart disease.
Yeah, lifestyle habits can play a huge role. What are some of the warning signs that you're either headed toward a heart attack or you might be having one?
So common symptoms you should never ignore are any discomfort in your chest. It could be upper chest, left side of the chest. It could be the shoulders, the jaw, between the shoulder blades, or even the upper abdomen. Sometimes people mistake a heart attack for indigestion. If you have those symptoms, even if they start out mild and happen with exertion, resolve with rest, you should definitely seek out medical care.
All right, Dr. Iafur, thank you so much for joining us here at 5 as we work all month long to help men with their heart health and their overall health. Thank you for being here.